And I'm going to turn it over to Megan. And everyone, please be sure to mute yourselves. If you don't, I will mute you. If you have a question, just follow Dr. Savage's instruction for how to ask.
Thank you, Dr. Pusafero. Like she said, I am Dr. Megan Savage, and thrilled to be with you here this evening or late afternoon if you're on the West Coast. What I'd like to do this evening is talk to you a little bit about what mindfulness is and why it's so important in healthcare. And so I first started a mindfulness journey back when I was in graduate school. And I realized that I was constantly doing assignments and readings and thinking about what's next? What's the next exam? What's the next clinical placement I'm going to? What's the next report I have to write? And stopped and realized I really wasn't living in the present moment. I really wasn't thinking about what I was actually doing at that time. I was just so focused on the next thing. And so that's when my quest to become more mindful, or on a journey to become more mindful, started, was a while ago. And then now you'll hear the term mindfulness quite a bit. And so several years ago, I had the opportunity to take a course on mindfulness, and then did a research study with mindfulness with students that were undergrad and graduate students in a communication sciences and disorders program. And then now, as part of our speech language pathology program on the Austin campus and Dallas campuses, teach mindfulness to our SLP students across the curriculum. And so this evening, I'd like to just talk to you a little bit about, what it is, what the evidence is, and how to actually practice it. So we're going to first start off and talk about life stressors that we all have as healthcare practitioners, as students in graduate programs. Then we'll discuss about what mindfulness is, the consequences of not being mindful, how to practice it, what the evidence is for mindfulness. Healthcare students in mindfulness training will actually practice for a few minutes, practice meditating for a minute, and then have a discussion, open it up for a discussion with all of you to talk about how can you infuse these practices into your life. So if we think about, what are our life stressors right now? Well, there's a lot, right? There's life in general, kids, families, relationships, your practicals, your jobs, exams, clinical placements, field work, the list goes on and on. And a big one right now is COVID as well. Let's not forget the global pandemic that's going on, the civil unrest. There's lots of stressors. And so, in order for us to be focused on the jobs that we have and the training that we're involved in school, we need to figure out how to better cope. And so mindfulness is one way that we can do this. So I know that it has become a buzzword the past couple of years. You'll see it standing in the grocery store line. You'll see magazines listed talking about mindfulness, and you'll see it all over in social media. But really, what I'd like to do is really break down, what does that actually mean and how do you do it? And so let's talk about the definition. And this is based off of a definition by Jon Kabat-Zinn. And he was a professor, or he is a professor emeritus of medicine, and he is the creator of the Stress Reduction Clinic and the Center for Mindfulness in Medicine, Healthcare, and Society at the University of Massachusetts Medical School. And he started a now very popular program called the Mindfulness-Based Stress Reduction Program. And so here is his definition. His definition is that mindfulness is paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. Okay, so let's think about this for a minute. So it's paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So we want to pay attention to our mind and our body in the present moment. And we don't want to get caught up in our opinions or our likes or dislikes. We want to just focus on the experience of that moment, because all we have is the present moment right now. So let's talk a little bit about what mindfulness is and is not. So mindfulness is a metacognitive strategy. And so metacognition means you're thinking about your thinking. And so we're thinking about paying attention. We're thinking about our thoughts at a certain time. We're thinking about focusing on experiences in our present moment. The wonderful thing about mindfulness is that it's a really simple tool. You don't need a lot of things to do it. You just need yourself and time and practice. And so if you can afford yourself a little bit of time and practice, you can begin a mindfulness journey to cultivate it over time. But what I do want to emphasize is that it's truly a journey. You don't just ever say, I've arrived, I'm a mindful person. And there are days where you might be more on top of things and more present than other days. And so, I'm here to tell you that it truly is a journey. What mindfulness is not is it is not a panacea. In no way, am I saying, or is any of the research saying this is a cure-all? We are going to talk about some evidence about, what it can help with, and there is a lot of research about how it can be used as a clinical tool for an intervention in lots of different areas, healthcare areas in particular, and mental health areas, but in no way am I saying that it's going to cure all. It is not easy. So it is not easy to practice mindfulness and to practice meditation. It takes a lot of practice, and there's no formula. So you don't just go, if I do this X amount of times, then I'm good. There's no formula to it. It's your own journey as you go along. So let's think about times when you're not mindful. Have you ever read for your class, you've read a textbook, and you get to the end of the chapter and you think, I have no idea what I just read? Can anybody relate to that? Or if you are treating a patient or client and you are thinking about your next session or what notes you need to write, and you're not really thinking about, the person in front of you. Or, on a more broad level, if you're just too stressed to be productive, you're just thinking about, you're consumed with, I'm feeling stressed or I'm feeling anxious, and I can't get anything done. Or if you're thinking about what a conversation that just happened and you're not focused in on this present moment. So I'm sure we can think of lots of examples of times when we're really not mindful. And sometimes we can have analysis paralysis where we can't even thoroughly think through what to do next because there's so much going on. So we need to think about, this is truly a problem. I think that we go through our day quite a bit not being mindful and not being in that present moment with whatever it is that you need to be engaged with. And so we need to think a little bit about, what are the consequences of not giving a present situation your full attention? So not being mindful. So there are personal consequences to not being mindful. Think about one example is if you're tipping at a restaurant and you're not thinking about it and you don't adequately tip that person and you walk away and you think, wow, what was I thinking? Or think about relationships that you have with people if you are not in that present moment when they're trying to have a conversation with you. There's myriad examples of, relationships where you need that person to be mindful to maintain the trust and relationship. Think about professional consequences. So think about your relationships at work with your colleagues, your professors, your supervisors. Think about your patients, down the road, your employers. So think about some of these consequences if we are not being present and giving our full attention in that moment. So now that we've talked a little bit about times when we're not mindful, hopefully you're starting to think, oh, this would be an important thing to do, is to be present in the moment. And so we want to talk now about, how to practice mindfulness. So just like you exercise your muscles when you work out, you exercise your brain by practicing meditation. And meditation is a way to become more mindful. So meditation is the exercise for mindfulness. I hear a lot of people tell me that they are terrible meditators. They'll tell me, I can't meditate to save my life. My mind wanders and I just can't do it. Well, that is the whole point. The whole point of meditating is to practice bringing your attention back to a certain point and bringing your attention back to the present moment and focusing it on something like your breath. And so if your mind wanders, which is normal and natural for it to wander, well, then you bring it right back. And that's the exercise. The exercise of your mind is bringing your attention back to the present moment when it starts to drift. There's a really good quote from Holly Rogers, who wrote a book on mindfulness that I'll talk to you a little bit more about at the end. And she says, the goal during meditation is to fully inhabit the present moment by holding your awareness on the sensation of your breath or some other sensory experience. Inhabiting the present moment establishes the conditions that may produce a stable state of concentration in which you are aware of your thoughts and feelings without engaging with them or reacting to them. Okay, so this last part where she's talking about you are recognizing that you're having thoughts or feelings, but you're not engaging or reacting to them. So that is the non-judgmental part in the definition that we saw earlier. You're not thinking about, why am I thinking this, or why can't I turn off my mind, or, attaching some thought or emotion to the thought process you just had. You were just observing that you are thinking about something else and you're bringing your attention back. And so there's lots of different ways to meditate. And when you look at the literature, there are myriad different meditation techniques. For mindfulness meditation, there's a couple of ways to do it. There's focusing on your breath. There is a body scan. Gentle yoga is often a good thing to do because you're focusing on the sensations of your body, and oftentimes there's breath work associated with it. Sitting meditation, a walking meditation, and mindful eating. So let's talk about some of these ways to meditate, and just know that there is no one right way to do it. Okay, so the first one we're going to talk about is focusing on your breath. This is a really good place to start because your breath is always present and changing. And so it's a really good thing to continue to bring your focus of your attention back to. And so when you focus on your breath, you're focusing on either counting in and out on your inhalations or exhalations, and focusing on breathing in and out. And then when your mind starts to wander, then you notice my mind is wandering. I'm going to bring my attention back to my breath, and then focus on the breath. And then each time your mind wanders, you're continuing to bring your attention back to your breath. And so even if it takes 100 times to bring it back, that's the point, is you're exercising your mind to continue to pay attention in that present moment. So focusing on the breath is one way. Body scan is another way that you can practice. And so this is where you focus on your body sensations. And you can start with the top of your head and move down. And you start with recognizing the sensations that you're feeling in your head. And then you move down and think about, recognize the sensations you're feeling in your face. And then you progressively go through your body, focusing on the sensations that you're feeling from your head to your toes. Another way to practice would be mindful walking. So sometimes it is really hard to sit still. And so sometimes you've been sitting for a long time trying to study or trying to write a paper or work on something, and the thought of meditating and sitting still just may not be appealing to you. You may feel like you need to move. And so when you're feeling restless, mindful walking is when you slowly walk. You either go inside or outside, ideally outside if you can. And instead of focusing on your breath, you are focusing on the sensations of your feet as you walk. And so you're slowly walking and you're focusing on the sound and the sensation of, slowly walking on whatever surface that you're walking on. You're really paying attention to what that feels like. And then again, when your mind starts to wander, then you bring your attention back to the sensations of you slowly, mindfully walking. Okay, and then the last one we'll talk about is mindful eating. And so this is when you bring your full awareness to what you were eating. How many times do you eat in front of your computer, or when you're driving, or when you're watching TV? I mean, all of us can say that we have done that, and some of us do it pretty frequently. And when you can eat a whole meal and have no awareness of what you just ate. And so mindful eating is really focusing on just your food in front of you, focusing on the color, the taste, the flavor, the temperature, the texture, the sensation of your food. And so it is slowly chewing and really feeling the sensation of and the taste of what you're eating at the moment. If this sounds a little funny to you, I challenge you to try it. Go home this evening when you eat something and try just for a few bites and slowly, eat something and really taste the flavors. And it does taste different. And you will notice different things because you're actually paying attention in the moment. There was a really interesting study that I saw recently that was talking about saying some sort of message of gratitude or prayer before you eat, and they were measuring intake of minerals from a green smoothie. And they had a group of people that said a prayer or gratitude before they drank the smoothie, and then they had a group that said nothing, and then they measured the mineral absorption of this green smoothie, and the group that said the gratitude prayer at the beginning actually absorbed more minerals, and so out of the smoothie. So then you think about, they're bringing their attention to, what they're about to eat, and there's bringing that focus of attention and gratitude. We know gratitude. There's a lot of research on gratitude and mindfulness and how they go hand in hand. Okay, so we've talked about, what mindfulness is. So we're talking about paying attention in the present moment and a few ways to cultivate it. And I'll talk a little bit more at the end about some resources on how to continue this cultivation path. But let's now focus on the evidence behind mindfulness. What does it actually do? Well, let's look. There was a meta-analysis that was done on the effectiveness of mindfulness-based programs for the psychological health and well-being in non-clinical samples of people, so people that didn't have a predisposal for a mental health disorder or substance abuse or any other documented condition. And so there were 49 studies that were reviewed in this meta-analysis of these mindfulness-based programs, and they had a group that went through a mindfulness-based program and then a control group. And these studies found a significant reduction of symptoms in rumination and worry, stress and psychological distress, depression, anxiety, and significantly improved quality of life and well-being. And so when you read some of these studies, several of them use the same types of outcome measures. They use perceived measures, patient-reported perceived measures. They use biological and electrophysiological measures. And so there's several different ways that they're measuring this. But one thing I'd like to highlight here is, they're talking about reduction in stress and anxiety. And, it's really important to point out that these are not one and the same. And so stress is not anxiety. So stress is typically due to an external thing, such as, a deadline or an exam that you have coming up, or some sort of external imposed thing. And so it typically goes away whenever that external factor goes away. But anxiety is different. So anxiety is the reaction to stress. And so it's that persistent feeling of apprehension or dread all the time, even if the threat is not there. And so, I really want you to focus on this, because a lot of the studies on mindfulness have talked about how it lowers stress and anxiety. And, maybe this is familiar to you in graduate school. I have talked to a lot of students that talk about how it's not just the stress of graduate school, but the stress of graduate school causes a constant state of anxiety. So keep that in mind as we're going through some of these studies. So there are some additional studies on mindfulness training that have also found that there are changes and improvement in attention and executive functioning and working memory, decreased rumination and distraction, so people are able to focus more. And then there are some studies that have talked about cognitive performance has improved. And then, I'd like to further highlight some of these studies that are looking at brain changes. So they're looking at the neurophysiological anatomy and physiology after doing mindfulness-based programs. And so there have been several studies that have looked at this, quite a few, and to collate this information, studies have found that there is increased activation in the prefrontal cortex. So we know that's where our, thinking, planning, decision-making, executive functions take place. There's increased activation in our anterior cingulate cortex. And so the anterior cingulate cortex we know is implicated in empathy, impulse control, emotion, your decision-making abilities. So there's increased activation there to be able to better control our emotions and empathize with other people. Increased activity in the insula and the hippocampus. Mindfulness training has also been found to alter the structure and function of the amygdala. And all of you, I know, have taken anatomy courses, anatomy and physiology courses. The amygdala, is that area for the perception of emotions and controlling aggression. And so there's been some really fascinating studies showing that the structure and function actually changes the amygdala. With long-term practice, long-term meditation and mindfulness practice, some studies have found thicker cerebral structures associated with attention. They found no significant decrease in gray matter with age. And then some other studies have found, just again, attention, introspection, and emotional processing. So these are really fascinating studies showing that not just the perception of stress and anxiety can go down, but there are actual anatomy and physiology changes that do occur with continued mindfulness and meditation practice, which I think is pretty fascinating. And so now let's turn our attention to cultivating this in university programs. So there have been quite a few studies on university trainings of mindfulness, and they have found a reduction in stress, burnout, depression, and an increase in coping skills and well-being. So this is just overall in university studies. They have found this with university students. But we are all particularly interested in healthcare and healthcare education. And so let's look at healthcare students and mindfulness and some of the evidence behind teaching this population of students. All right, I know what I'm about to tell you are your lived experiences. And so you will be glad to know that you are not alone and that these challenges that you have as a healthcare student are well documented in the literature. So it is well documented that healthcare students have higher levels of stress than your same age peers and gender and age matched peers. So your friends that are not in graduate school, that are having a great time binge watching shows and you're stressed out about school, well, it is a typical experience for healthcare students. And so this increased stress it can affect your academic performance, and it can affect your individual welfare. And so we want to think about, how can you be a mentally healthy graduate student to bring your best self forward to the game, to learn the material, and to become an excellent clinician. And so that's why we're talking about, how can we cultivate mindfulness? Because this is one way to do this. Some other sources of stress for healthcare students cited in the literature: high-stake exams, large amounts of content to learn and then quickly apply in your fieldwork and practicums, lack of free time, perfectionism. A lot of us, have come to this profession and we feel like we are working with other people. We have a sense of perfectionism. Imposter syndrome happens to a lot of us, where we think that why am I the one that's doing this? I feel like an imposter. I don't feel like I have the knowledge or the skills to be able to treat this person. And there's a lot on imposter syndrome. Financial challenges, a change in living situation. Your support systems change when you're in graduate school. Your clinical education experiences, although wonderful, they can be really stressful. So I know you are all, living this experience right now, and it is well documented that it is normal to be experiencing these in school, but we want to cope with them. So let's talk about some studies in some of our disciplines that we have here at USA. So there's been several studies, and I could not review all of them. I highlighted some of these for you here. There's one that was done in PT, in the physical therapy world, for mindfulness and meditation. And there was a study that was conducted with 24 DPT students to measure the effect of meditation on anxiety and stress. And they did an 8-week mantra-based meditation program. And they had significant findings, and there was a significant reduction in blood pressure of these students and significant perceived stress reduction from pre and post. They also looked at cortisol levels, and so they were looking at those stress levels, those biological markers of stress, and they swabbed the students in the morning and the afternoon. They did not find a significant decrease in that. The authors talked about how it may not have been enough time, an 8-week pre-post, but they did find blood pressure reduction and perceived stress to reduce. Another study in the physical therapy literature talked about 32 students that were measured before and after an 8-week curriculum on stress and mindfulness, and they found significant findings in improved perceived stress and improved mindfulness reports. And then when we look at a combined study on mindfulness with occupational therapy and physical therapy students, the OTPT students were randomized to a control group and the intervention group. And the intervention group got an 8-week mindfulness program. And so pre-post, there were significant findings in perceived stress scale was significantly reduced. The student stress management scale was significantly reduced post mindfulness training. In the qualitative questionnaire that they gave students, the students in the mindfulness group reported greater sleep quality, higher energy levels, more self-compassion, and a better work-life balance. They also measured GPA and counseling frequency visits, and they didn't find a difference in GPA or counseling frequency. However, when you think about if someone has the perception that their stress is lower and that they're reporting greater sleep and energy levels, that's pretty positive. When we look at the speech language pathology discipline, there was a randomized control study that was done that students practiced mindfulness for 1 semester in the intervention group, and then there was a control group that, that did not get the intervention. And post the mindfulness group, there was significantly decreased perceived stress, significantly improved self-compassion, and they had a perfectionism scale, and there was significantly reduced negative aspects of perfectionism. They did have some electrophysiology measures of stress, which were significantly reduced after the mindfulness program. And then they measured attention, but they did not find a difference in attention in this time span. And then when we look at some of the literature in nursing students, there are studies that have looked at a pre-post and follow-up design with 120 second-year nursing students. And this study showed mindful attention awareness scale was significantly higher post the mindfulness training. Depression, anxiety, and stress scale was significantly decreased. And then in a meta-analysis that looked at 5 RCTs on mindfulness in nursing students, the results across these 5 showed reduced anxiety, reduced stress, reduced depression. The depression, they only saw a reduction in after an 8-week intervention compared to 1 week. There were some studies that did a 1-week intervention. Depression did not change after 1 week, as we would expect. And then when we look at some combined studies that's looking at mindfulness and allied health and social care professions, there was an excellent systematic review that looked at mindfulness education in occupational therapy, physical therapy, social work, nursing, psychology, counseling, speech language pathology, and audiology. And across these studies and these professions, the mindfulness training they saw a better management of stress, anxiety, and depression, which we saw in those previous studies. Better academic skills using attention and concentration for learning. A development of empathy and positive relationships for your professional practice when you get out and you're working as a clinician. And we'll talk a little bit more about that. Self-management, self-awareness, and self-care all improved. And then improved perceived quality of life and a promotion of resilience. And so these are all really positive things that have been documented in the literature with practice, and most of the practice was talking about an 8-week mindfulness practice for these students. So why is learning this skill important as a student? I think it's important as a student to think about how the stressors of graduate school are real, and how can we better cope with that. And then also we need to learn these skills first before we become healthcare practitioners and work with our patients and clients. And so I really like this quote to share with you. So students must possess the ability to manage their personal stress, before they will be able to deal with the pressures of being a care provider. So developing strong coping strategies to deal with and even reduce the perception of stressors is imperative for future healthcare providers and may be facilitated with mindfulness training. So I do want to point out that there is a lot of research on using mindfulness as an intervention tool with clients in lots of different fields. So in the physical therapy world, there's articles that are talking about how it can help with patients with chronic back pain, with other physical rehabilitation needs. In the mental health world, there's quite a bit of documented literature. In the occupational therapy fields, there is quite a bit on how the OT is well situated to bring mindfulness into intervention, and because it's so helpful in the occupations of daily life. In the speech language pathology world, there is quite a bit of literature on training mindfulness in voice patients and people that stutter, to bring awareness to what's going on with your voice and fluency at the present moment, and how you can reduce that stress to improve your fluency or your vocal quality. And nursing and medicine, there is a plethora of literature there. That is a whole nother presentation. But what I'd like to point out to you is that before you use it as an intervention tool, and you obviously need to look at the evidence before, because we, of course, want to do evidence-based practice, and you need to know the literature. But before you do that, you need to be able to cultivate it in yourself. Be able to manage your own stress and be more mindful on a daily basis before you use it as an intervention tool. And so this next study is talking about, implications for professional practice. In these meta-analyses of these studies with mindfulness training with healthcare students, they have found students to report when they actually go work with patients and clients that they are more focused, they're more empathetic to the patients and clients, they're more present in that moment, they're more accepting with their patients and non-judgmental. And so I have, read the reports and seen people and students and clinicians report that what mindfulness can do is it can help you slow down the therapy process and just listen. Just listen and observe in that present moment what that client is telling you. And instead of sitting there thinking about, formulating your judgment about what this person is going through, if you could just be more present in listening to what that person is describing to you that they're experiencing, you become more empathetic, you become more focused in on what is the task and what can I do to help further this patient in their rehabilitation, or address their health concerns. So I want you to think, for a second, you can have two equally qualified clinicians that are both academically and clinically trained. However, if one is practicing as a mindful practitioner and the other one is not, you can have two very different patient outcomes. And I'd like you to think about the power of mindfulness training and how you could have a lot better positive patient outcomes. If you think about, how we can use some of these skills in our professional practice interactions with our patients and clients. Okay, so now we've talked a little bit about, what is mindfulness? There's a lot of evidence on it, and a lot of the evidence you'll see is talking about the same thing. I mean, you should have heard over and over that it's talking about reducing stress, reducing anxiety, perceived quality of life. So now I'd like to practice for a few minutes. And so I would like for you to close your eyes and get comfortable in the space that you are sitting in. And for 2 minutes, I would like you just to close your eyes and focus on your breath. And so I want you to take a deep breath in and then slowly blow out. And continue this slow breathing pattern. And if your mind starts to wander, it's okay. Just bring your attention back to your breath and breathe in and breathe out. Okay. Slowly open your eyes. Now, does someone want to offer to comment on that experience? It's only 2 minutes. Do you feel like your mind was wandering a lot? Was it difficult to focus on your breath?
I felt like my mind was wandering quite a bit during that time.
Yes, which is such a normal thing. And then when it was wandering, did you just remind yourself to focus back?
Yeah, to like focus back on breathing.
I was experiencing pain in my neck, shoulder, because I have a couple of bad discs from an accident, and I was focused on my breathing, and the neck pain went away.
Yeah. Did you notice the neck pain before you started breathing?
Oh, the whole time I've been sitting here. Yeah, that's been
Yeah, so
bothering.
yeah, sometimes when we just focus in on something, you know, just giving our attention to it really can help alleviate it.
I feel like I've done this in the past where, sorry, my phone's going off in the background.
Okay.
Done this in the past where I was instructed to sit back and relax in a relaxing position, but this particular time I'm sitting at my desk, I'm working on papers, I'm listening to you, so I'm pausing to do this, and my feet are grounded And I feel like that was so much more effective than being in a position of like comfort.
Mm-hmm.
That it was a lot easier to maintain that focus with that grounded feeling.
Mm-hmm. Yeah, thank you for sharing, Tina. I feel that way. I know a lot of people report that when they get in that comfortable position, when they finally stop, then they start to fall asleep.
I found that it's very beneficial in two ways, in the morning and in the evening. That's when mostly I've been using a meditation. But it's also linked to my phone, and I was curious to discover the effect that it was actually having on the heart rate and respiratory rate. It had a positive impact over time the more that I did it.
Mm-hmm. And Joe, did you notice that it takes time? It takes practice?
Absolutely. It's like anything else. It's like, it is like you had said earlier, exercising the mind and being able to approach things in a way that, it is a skill that your body responds better to with over time.
Mm-hmm. Anybody
Hi,
else?
my name is Sarah. I'm from the St. Augustine campus. I'm currently in Georgia though, and it was nice because I was listening to your talk on our porch, and it's raining right now. So it was very nice to tune in to the audio of the rain, as well as notice any physical sensation. And the breathing. So thank you. I enjoyed that.
Oh, good. I'm so glad. Thank you for sharing. Anybody else? So this was just 2 minutes. So even just 2 minutes of your time, can put you in a different, mental state. And sometimes, I can close my eyes for 2 minutes and I don't feel any differently afterwards. Sometimes it helps dramatically, and sometimes, it doesn't help at all, which is okay. Which, as we're talking about, it's a journey. And I have a lot of students that report to me, they say, I just can't sit. I can't sit and close my eyes. And so a lot of students report to me that the walking meditation helps them a lot to get outside and to really focus on just that feeling of the sun on your face, or hearing the crunch of grass underneath your feet. At least our grass is crunchy in Central Texas because it's so dry. But just recognizing that what we're not normally paying attention to. So there are lots of resources to practice mindfulness. One resource that I really like for anybody that's just getting introduced to mindfulness, it's a book called The Mindful 20-something, Life Skills to Handle Stress and Everything Else. And Holly Rogers wrote this book. She's at Duke University. And she wrote this book for 20-something-year-olds. And while, many of us are not 20-something-year-olds, you can replace whatever age and life circumstances you are with, what's in the book. But it's a really good, just straightforward, an introduction to mindfulness. Here are ways that you can practice these, and just talks to you in a very clear way. So I really, I recommend this to students, that they read this throughout the SLP curriculum, and we build on discussing it. John Kabat-Zinn, that I mentioned earlier, he has a book called Full Catastrophe Living, Using Wisdom of Your Body and Your Mind to Face Stress, Pain, and Illness. And there are so many books. I mean, I can't begin to tell you how many books there are in mindfulness, and I've read quite a few, but too many to list here. There are lots of apps as well. So Insight Timer is an app that I use a lot. It has guided meditations on there, and then it has a timer. So you can time yourself and say, you know, I want 5 minutes, and a nice gong to chime at the end of that. The guided meditations, you can choose them based off of if you want something for anxiety or stress or depression. I use it every night with my kids. They like to listen to a kid-focused meditation at night. So Insight Timer is free. I use that at Will and a lot. There's Calm, there's Headspace. There are so many apps out there, many more than I can list. So if you feel like your mind is wandering too much on your own, using a guided meditation is perfectly fine and acceptable. And like I said, there's no one way to do it. And so there are different strategies that you'll learn over time. And this Mindful for the 20-something book talks about these different strategies. And sometimes in one meditation session that I have, I'll employ all the strategies. I'll focus on my breath. I'll do a body scan. I'll do a mantra where I'll say, I'm breathing in, I'm breathing out. And maybe a longer mantra. So there is no one right way to do it. And there's no great, you know, you've arrived, you know, like I continue to stress, it's a journey. And I think it's a journey worth going on, because we want to be able to cope with the stresses of life in our jobs and as healthcare students. And then we are all in professions that that is well documented that we are working in high stress situations, and we have the well-being and the patient outcomes and patient care that that we all want to perform well. And if we want to be different kinds of practitioners and increase our patient outcomes, I think this is a really excellent way to cultivate that. So I would like to hear a little bit more from you all on ideas on how you can infuse this into your daily routine in life. And, you know, like someone just said, just sitting at your desk, even when you're working, if you just take a second just to close your eyes and refocus, it could be beneficial. But I'd like to hear some, you know, from you all and some other ideas.
I'm curious, do you use this at the beginning of any of your classes?
That is a really good question. I have done it not in my, well, I have a couple of times. I'll take that back. I've done it in a couple of my synchronous classes before online, but I do it when our students come to campus for our on-campus residencies for our speech-language pathology program, when they're in person as well. And I've had students reach out to me and say, can you just hold a mini mindfulness session for us online?
Thank you. That was the first thought that came to my mind as you were talking about this.
And you know what? I think when I have my synchronous session with my class, I think I'm going to start it out with that. Thank you.
I'd just like to say something in general. I did a lot of work with the hippocampal area of the brain. And one thing that you didn't mention, which is so important for students, is that if you get too much anxiety built up, the hippocampal area of the brain just does not form thoughts. Don't remember what you're trying to study because it's knocked out by the cortisol that you're creating from your anxiety. And so there was a taxi cab study, a taxi cab driver study in London many years ago, which I remember, where they were looking at the actual structure of the brain, the size of the taxi cab driver's brain, and the hippocampal area in particular. And they found that because they were constantly practicing short-term memory, their hippocampus actually got bigger than other people's. And so you have to think about that when you're trying to stress out and study in school and so forth, and just take time out of your day to calm yourself down, even if you have to take a supplement that will, like an adrenal supplement that relaxes you, or a health remedy like Bach flowers, and that also leads to relaxation. And just take time out to do it because you're damaging yourself when you're too stressed.
Mhm.
Actually, physically hurt your short-term memory, and it's really hard to make it stick. Whatever you're studying, it doesn't matter. It won't go in if you're too anxious. So that's my comment.
Thank you. I so appreciate that comment. Fascinating study, and you're right. You know, if no matter how much you have to study, if it's not able to go in, then what's the point? What are you doing right then? And we do need to employ a different strategy. So thank you. That's an excellent comment.
You're welcome.
Hi, this is Eleanor. I just wanted to share, I used different mindfulness techniques at different times in lieu of a reflection before a meeting.
Mm-hmm.
Or I've actually, when I've had people just getting, you can like sense the anxiety or the stress, or people are talking over one another, I've actually stopped meetings and made everyone do a mindfulness and just kind of get on the same page, and everyone calms down, and it really helps with meeting facilitation when you're in, like, particularly in stressful situations and you're having difficult conversations.
Mm-hmm. Oh, yeah, absolutely. There's some really interesting studies about using mindfulness in large organizations, you know, General Mills, Google, you know, some of these large corporations, and how they talk about using it in meetings and then in their organizational structure as well. Excellent comment.
I'll chime in that I know of a single mom that uses this with her child to calm him down as they transitioned into living in a situation. The child had significant cognitive, speech, and language issues, and which affected the overall communication. By using the mindfulness and meditation, particularly at night, but then to calm the child, the behavioral issues dissipated. So it's kind of an anecdotal story, but it certainly rings true that it can be used in many different ways.
Mm-hmm. Yeah, I'm starting to see it quite a bit in elementary schools as well, and you know, having elementary age school children now, they send out like a mindfulness bulletin and talk about how they use it in the class, and you know, my child come home and show me how they melt like an ice cream cone when they're feeling upset. And so it's really been fascinating to see the different avenues that this is being employed. Yeah, excellent comment, Joe.
Sarah here again. So to chime in with what Joe is saying, I think it's fascinating that I'm sure you probably have to have some kind of special training to implement this with clients, but I think it would be a wonderful tool for clients that struggle with dysregulation, or clients with PTSD, to kind of retrain the nervous system to react to stressful stimuli. Mm-hmm. But to answer your initial question, I'm a fieldwork 2A student on my first rotation right now, and I've found that, or I'm trying to implement mindfulness between sessions, but the sessions happen so quickly that it's so difficult to just take a second and reground and refocus on the next client that's coming in. So I was wondering if you had any suggestions for a very fast-paced schedule.
What I do, you know, in a very fast-paced schedule is I just close my eyes for a minute. You know, I'll maybe just turn around to grab papers and just close my eyes. And even if I can take just 1 or 2 really long, deep breaths, and just close my eyes for just a second, that tends to help center me. But anybody else have suggestions for what they do in a very quick situation?
This is Delaney. Are you there?
Yeah. Hey, Delaney.
Hi, I couldn't talk before. You had said what you do in quick situations. I'm sorry. I was saying that right while you were talking, and I'm a little behind because I couldn't make my audio work. But the college that I work for embeds mindfulness throughout the curriculum. And in the early courses, it actually gives it points for doing the mindfulness activities.
Oh, that's great. I've seen, yeah, more and more universities, they're starting to put it into the curriculum because we do have the evidence behind it now.
The
I
other
would
thing
also add that just being able to remove yourself from a situation for a couple of moments, like Dr. Savage was saying, it just changes the whole mindset, because if you just keep going and then you've got a momentum going and you haven't broken the momentum, even if you have only a few moments, it does make a difference. First, I'm going to go to this location just to be out of that for 2 seconds, and then I'll go back in. And I know that has helped me in the past as well.
Mm-hmm. Even that short walk to the next patient room, you know, can be helpful.
Going to the break area, going to the hall that no one knows that's there, or going to a window where I can look outside and see the trees and see something of nature, and just removing myself to kind of change the frame of mind, so to speak, especially if things are more chaotic than expected.
Mm-hmm.
Thank you. Those are
Great
such
point.
Good clinical tidbits. I appreciate it.
Anybody else have any comments or questions, additions to the conversation?
This is Eleanor. I just thought I'd share that a lot of times you know certain situations are likely going to be stressful, and so I prepare for them by taking a couple minutes beforehand to do some mindfulness, and then it helps me to remember that even if I'm in the middle of a situation, I feel some stress coming on or some anxiety over the situation, then I just do some heart-focused breathing and in the moment without having to close my eyes. But I find that preparing for situations is really important, just a couple of minutes before, if you know that you're going to go into something stressful.
Mm-hmm. Yeah, I absolutely employ that. Do any of you try that before you go into an exam or a practical?
Absolutely.
And if you don't, try it the next time. Yes, I love Joe's comment of it takes 31 days to create a new habit, and mindfulness is well worth this investment. Yes, it takes practice.
I have a little thing that I do when I go in, knowing that the doctor's office is usually anxiety provoking for some people. Every time I go to get my blood pressure taken on any kind of well check or something, I will do this, and it's incredible how much my blood pressure drops. And I think to myself, they must think I have such perfect blood pressure. But it really does work.
Yes, yeah, that's a great example. Any other comments or questions? So the list of references are on here. And I want to thank you for your time and attention and your thoughtful comments and questions and additions to this presentation. I hope that you see the utility of it as a person and as a healthcare practitioner and student. So thank you.
Thank you.
Thank you, Megan, and everyone. As I mentioned, the presentation will be posted on Keep Learning. You'll receive an email with the recording and the PDF of the PowerPoint. So thanks everyone for joining, and I hope everyone has a great evening.
Thank you. You do as well.
Nice to hear your voice, Joe.
Yes, same here.
Thank you.